Hello. Today, I just want us to discuss something called inflammation of the kidney. And that is called pylonephritis. Pylonephritis is defined as the inflammation of the renal pelvis, the lining of the renal pelvis, and the parenchyma of the kidney. And this is a very common, I'll call it illness because of the signs and symptoms that comes with it. So it's very common, especially in women. Why? Because women have a very short urethra, about 4 cm, and men have about 11 cm urethra in length. So it is easy for ascending infection in women. So it is very important for us to discuss or share, issues like this that may be affecting people and they are not even aware of the reason or the causes, and it's causing or posing a lot of anxiety in people. Pylonephritis is also common in pregnant women because of the frequency of urination, and in some cases, because the urethra is short, just as I've said earlier, there could be ascending infection, bending down, hovering over the toilet to use the toilet, sitting there all day for hours, for minutes. All these things can cause ascending infection. Who are the people, apart from women and men, that can have it? Children can have it, because of poor hygiene, lack of hygiene, wiping a baby from, back to front. Elderly people can have it, wiping from back to front, lack of, genital hygiene. These are the reasons why people can have inflammation of the kidney. What are the signs and symptoms? People that have pylonephritis, you see them having, lower backache, pains by the side, tummy ache. The temperature might be rising. They might be shivering. These are some of the signs that you can see in pylonephritis. Other signs could be the person may be urinating more than normal. The color of the urine may change. And you see, one of the reasons why people have it as well is because people, keep urine backwards. When they have the urge to go to the toilet, they decide not to go because probably they are too busy or there is no time. I'll keep it when I get home. I will use the toilet. Oh, I'll miss my train. I'll miss the bus. I'll miss the plane. I'll, use the toilet in the plane. And so gradually, from time to time, they accumulate urine in the bladder. And this can cause cystitis, inflammation of the bladder. And when this is not treated, it, ascends to the kidney over time. And you know what the kidney is in the body, how important it is. So I'm craving your indulgence. I beg of you. If you have the urge to use the toilet, do so immediately. Do not retain urine. Do not retain it. And a lot of people do not want to drink water because they don't want to use the toilet frequently. So, they just decide not to drink water. Some don't like to drink water because it is uninteresting to keep drinking water all day, all night, because water is tasteless. But you can add a dash of lemon. You can, put mint leaf in the water, cucumber in the water to give it another taste that you can, enjoy. Rather than saying you are not going to drink water and you drink just a cup a whole day. Mind you, minimum of at least 2 liters should be taken per day. If you are pregnant, you should be able to take up to 2.3 liters. And if you are an athlete or you are always very active, you can take up to 3 liters, because excess water as well is not good. You shouldn't take water in excess, because if you take water in excess, you can begin to have headache and so on. We are not discussing that today, but I just want you to know that water is very important, but too much of everything is not good. So how can I prevent pylonephritis or inflammation of the kidney? Just as I said earlier, as women especially, you don't hover over the toilet, sitting there all day, using your phone, sitting there, just because you want to relax in the toilet. You are carried away, you are so engrossed with messages on your phone, and you're sitting all day there. Do what you want to do and come out of the toilet in good time. Also, make sure you keep your genitals clean at all times. When you are wiping, wipe from front to back, not back to front. Because the causative organism, E. coli, when you do that, you sweep it from the large intestine, you sweep it to the urinary system. And once the E. coli is in the urinary system, you react to it. If it is in the large intestine, is in the rectum, it's fine. But when it goes to the urinary system, it poses problem. It's also very important for you to drink a lot of water to cleanse your bladder. Take a lot of water, just as I've mentioned, according to NHS. Make sure you drink water regularly. Make sure you take fibers so that you can empty your bowel when necessary. Minimum of 20 to 30 grams of fiber is recommended by NHS daily. Make sure you take it. A lot of us don't take fibers. Cucumber is a very good fiber. You need it, except you are allergic to it. Oranges are there. These things will help you. Instead of using laxative, using things to purge yourself before you go to toilet, you don't need all this. When you take fibers, you take water, roughages, you will enjoy your body. Let's not forget as well, it is also very important for people that, want to keep their bladder from, bacterial infections. You can take, I don't really subscribe for cranberry juice. There are cranberry juice, there are cranberry tablets. All these things, they don't allow bacteria, to cling to the wall of the bladder. For cranberry, might be too sweet for some people. The tablet is there. But for people that are on, blood thinning drugs like warfarin or aspirin, you must be very careful before you take cranberry juice or cranberry tablets. You must see your doctor. And all the signs and symptoms I have mentioned, if you have any of those signs and symptoms, maybe pains on your side for a very long time, backache, tummy ache, feverish feelings, your urine is changing in color, it's cloudy, your urine should be like straw-like color. But, when it's becoming cloudy, black, red in color or something, you must see your doctor immediately. Because there are so many reasons why people could have, pains on their side. It doesn't necessarily mean you have pylonephritis. So there are some people, after hearing this, they might say, oh, no wonder, hey, that lady has been having pains on her side, she's having pylonephritis. No, There are so many reasons why you could have pains on your side. And that is why it is very important for you to do a test to ascertain the challenges that you may be having. I believe this has helped someone out there tonight. And I will see you very soon. Before then, bye and keep smiling.